In case of the colonic Crohn disease, and especially see if you can see here, there are multiple skip lesions. The cecum is involved, the flexures are involved, the transverse colon is involved, and then the whole of the length of descending colon, they're also involved. And in case of that, if there's a healthy portion of a sigmoid colon, then you can go for ileocolic anastomosis. And if there is involvement of the rectum and anus as well, obviously the patient will end up with a urinary incontinence, and then you have to remove the rectum, and you have to do the remove the anus, where you have to do the proctocolectomy. And in that that will, if there is extensive removal of the disease and whole of the colon, rectum, and the anus is removed, then you have to do the permanent ileostomy. Or if there's some portion of the only if you talk about the if there is a rectal disease, or there's an anal disease, like the anal canal was full of ulcerations or rectal ulcerations, then you have to remove the rectum and the anal canal, and then you have to do the permanent colostomy in such patients. And in the isolated diseases of the anal canal, like if there's a perianal abscess which is present, or if there is the perianal abscess is accompanied with a fistula, especially the in case of that, it's not advisable that you do the fistulotomy. Instead, you have to place the cetone, especially most of the time these fistulas are high, so good to give do the proper incision and drainage of the abscess. And if there's a fistula present, then you have to place a acetone in the fistula, and then you have to give a good antibiotic therapy to the patient. So the proctocolectomy and total colectomy, that is reserved for the conditions in which there is extensive disease involving the whole of the segment of the colon, or it's involving the rectum and anal canal, and then you have to do the permanent ileostomy. Or if there is some portion of the sigmoid colon, the portion of the colon is paired, but only the rectum and the anus involved. Isolated diseases of the rectum and the anal canal in case of the Crohn disease are not very common, they're rare, but still you can encounter such cases. And in that you have to do the proctocolectomy, and if the healthy segment of the colon is present, then possibly you have to do the colostomy, just like that. Remove this is a healthy portion, the small intestine is okay, the rest of the portion of the colon is fine, and this is the part of the little bit part of the sigmoid colon, rectum, and the anal canal is obviously involved. Then you have to remove entire segment, the rectum and the anus and the colon, and the colostomy bag in the form of in depending upon the descending colon or sigmoid colon is bring to the exterior. And this is a type of a permanent colostomy, and it's a kind of a dilemma for the patient in a big stress, and you have to counsel your patient before treating him in the form of a permanent colostomy. So in today's lecture, we talked about the Crohn disease, we talked about the manifestations, we talked about the medical therapy, the approaches about like the step up and step down approaches, and when to do the surgery, like the indications of surgery, and the multiple options we have available in the form of ileal resection or ileocecal resections, and then when you have to do the primary anastomosis or you have to do the secondary anastomosis. We have discussed this in today's lecture. So thank you for watching sqadia.com.